and welcome. I'm Heather Lake, your CoolSculpting host. We're here in sunny San Diego at Nowak Aesthetics with board-certified dermatologist Dr. Nowak and his CoolSculpting specialist, Diana Martin. Dr. Nowak, thanks for having us.
No, thank you for coming. It's great to see you.
This is really exciting because today we have two CoolSculpting demonstrations with our beautiful patients here. Morgan and Greg, we're going to tell you a lot about the procedure and we're going to answer all of your pressing questions about CoolSculpting. How much it costs, how much time it takes, the downtime, does it hurt, and of course the biggest question, what are the results? First things first, Dr. Nowak, tell us a little bit about yourself.
Well, I'm a board-certified dermatologist. I've been doing body shaping and body contouring procedures for over 2 decades. And I love doing those procedures and we get amazing results. But now we have something non-surgical. So CoolSculpting is that non-surgical option. You have those stubborn areas, that little area that you can pinch more than what you want. We now have a way to do it with little to no downtime or recovery time.
For a lot of people watching, they may have never seen CoolSculpting before. Dr. Nowak, can you tell us what CoolSculpting experiences are like?
So the CoolSculpting experience is really easier than what most people think. So it really starts with them coming in to have an assessment, a consultation. We have Diana, our CoolSculpting specialist here, who is amazing. She's been working with us for over 10 years. She has amazing skills. She meets with our patients individually, determines a treatment plan, understands their goals, and then figures out everyone's different. So everyone has different concerns. We create a customized plan for the individual. And really here at Nowak Aesthetics, CoolSculpting is not just a treatment, it's an experience.
Sounds wonderful. Let's talk about that experience. Diana, can you explain what a patient will go through when they walk in the doors and want to start this procedure?
Sure. So we definitely have a very, very customized consultation. Everyone is an individual body, and we want to address every single need that that person may have. What makes the experience here at Nowak Aesthetics so special is that every single patient that comes in to do CoolSculpting will have the opportunity to meet with Dr. Nowak. He actually confirms all of my treatment plans. He's a board-certified dermatologist with over 20 years of experience. It really does come to this to make everything just be perfect for that patient.
Makes a big difference, the experience that you have. And Morgan, I know, has done this a few times, and now she's going to get the experience all over again today and be able to talk to us about what this experience is like for you. So Morgan, first things first, why did you decide to get this procedure?
Well, I've been coming to Nowak Aesthetics for some time now, and I really trust and love Dr. Nowak. And I'm active, so I told him I have some stubborn areas that I really wanted to work on, and he invited me to come to one of the cool events and meet Diana. So I did, and I actually brought my brother Greg, and he had some of the same concerns. So we went, and yeah, and we decided to do it.
So Diana, what are we going to do today? How have you already prepped the patient?
So we already went ahead and wiped down the area following every single step of the protocol for CoolSculpting. We are going to be placing a little gel pad to protect the area. In her case, for Morgan, we're going to be working on that little flank area back here. And in a moment, you'll see how it all starts.
All right, I'm going to let you go ahead and get the treatment started so we can see that. And I'm going to talk to Dr. Nowak a bit about all of the different treatment areas that you have as options here. So at Nowak Aesthetics, I know you have the most amount of treatment areas possible that you can do in one time.
Yeah, so we have 4 CoolSculpting equipments here. It's the only location in San Diego where you can have this done. So literally in this case, we're going to be treating 2 patients at the same time. I had it done personally, and I had all 4 on me at one time. So
is this one of the most stubborn areas to get rid of fat? And then what do you see as far as CoolSculpting, the results that happens with this flank or love handle area?
yeah, so there's many areas that we can treat. So the treatment, I had it done, literally I was in the operating room working the next day. So little to no downtime or recovery time. What you'll see or feel is what you're pinching is going to be reduced. Those little fat cells, the body starts breaking them down on day 3, and over the next 3 to 4 months, your body naturally gets rid of those fat cells.
Okay, she's getting all set up over here, and I'm wondering with Morgan, what should she expect? What will the skin be doing as the CoolSculpting suction, so to speak, is put on her?
Yeah, so well, CoolSculpting feels cold. So there's a little suction as it pulls the skin and the fat cells into those areas. It starts getting cool, it crystallizes the fat cells, and it causes just a little trauma or injury, and then our body gets in there and naturally breaks those cells down.
So as part of the procedure of CoolSculpting, there's a little bit of prep. what is Diana doing right now?
So it's a very easy prep. She has a little gel pad that she's placing on the skin, and it acts to protect the skin, and it helps the cool to penetrate through the skin and get into those fat cells. And so it's kind of like if you have butter at room temperature, it's nice and soft. You put it in the refrigerator and it turns hard. So that's what's going to happen to those fat cells. They're going to get cooled. They're going to get crystallized. She's going to take the little applicator. We have different shapes and different sizes for different body areas, so it is super customizable. And so she's going to place it on that area. There's a little bit of suction, so it'll kind of pick up the skin and the fat cells, and it'll start cooling them. And it'll get cool, 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 cool. It goes cold like you're playing out in the snow, and then you won't feel anything. And then it's only 35 minutes, and that area has been treated and taken care of.
We have Greg over here who's been sitting here for about 20 minutes or so.
Yeah, so he's progressing along with his treatment. So we have about 11 minutes left on this area. Then we will remove the applicator. We'll see that there's a little bit of redness on the skin, and it'll be a little bit firm. And then we're going to be working with our Z-Wave equipment over there, and that's a technology, a sound wave machine. So where some locations they just do a little manual massage with their hands, we actually have special equipment that helps to break up those fat cells even faster.
What's something that you can do while you're sitting here? Could you take a nap? Are you
Sure.
checking emails?
So we have people that are working, playing on their phones, checking their Instagram. We have patients that are watching Netflix, and you have people that would literally take a nap. So now that the treatments are quicker, it's hard to get a good nap in. But yes, they do take a quick nap there.
Let's talk to Greg since he's been on this equipment for a little bit of time now. What does it feel like when you initially got into the CoolSculpting, and how does it feel now?
It's very comfortable. When I first started, it was a little bit of suction and a little cold, but now I don't really feel much.
You're just sitting there with the blanket on, enjoying your time. I think the interesting part about this is the results. How many times does someone have to sit here, do the CoolSculpting, to see results, to see the love handles actually shrink?
So that's part of the consultation process, is to determine what is their goal, what is their expectation. We're going to statistically knock out like 25% of the fat cells. So for some people, that's enough to get them to the result, and some people will have areas we have to go back and target a second time.
We see both Morgan and Greg enjoying their time at the CoolSculpting. There's also other areas. There's more than just the love handles that you can treat now. Can you talk a little bit about that?
We can do the abdomen area. We can work back onto the love handles. We can work onto the arms. They also have a really cool, the mini applicator does the submental area, which is amazing because for years, patients would come in with that and surgery was their only option.
Oh, wow.
So now we can target those areas without surgery.
Very interesting. So we have Morgan all set up. Let's check in with her and see how she's feeling. Morgan, what was it like to get the initial pinch from the CoolSculpting machine?
It doesn't hurt at all. It's just a little bit of suction on that area. And I mean, I'm really just excited to see the results.
Feels probably cold.
A little bit, a little cold, but it's not too bad.
So a lot of the patients here are getting the experience. For people at home, they have questions, they have comments. We're going to talk about some of those commonly asked questions right now.
Sure.
One of them being, is this a lunchtime routine? Can you come in here, hang out, do a couple of emails, and then afterwards just go on about your day? Or does your body look a little funny after the procedure's done?
No, this is a super easy procedure. This is definitely a lunchtime procedure. So patients could literally come in with the new equipment, new technology, 35 minutes with multiple systems here. We can treat multiple areas. Little to no downtime. I had it done. I was up right afterwards seeing patients.
When we talk about the CoolSculpting, a lot of people have seen reduce in fat and you know, they move on and they want to maybe work on something different. Maybe they choose a different body part that they want to do next. When they come in here for their second procedure, though, should they be doing the same one over and over again? How many different treatments?
At the consultation, we create the treatment plan for them, okay? And we understand what their concerns are, what they're pinching, and then we start with the treatment plan. And some people say, I only have specific areas, and some patients will come in and say, I want to work on everything. Mm-hmm. So it is very customizable for them. If we know they have certain areas that they have a little more to pinch in that area, we're going to plan on treating that a second time.
Biggest question. How is what's the fastest time that you've seen this work?
So this is
that fat melt
yeah,
away?
this is a great story. This is a patient that came in and we could only do his right side that day because he was coming in after work. Comes in 2 weeks later to do the other side, and he's like, look at this. There's a difference. He could already see that. Now, if both sides were treated, it wouldn't have been as dramatic, but he could literally look down and see the right side was going in, in only 2 weeks. So in a couple weeks we see it, 3 to 4 months we're going to hit the maximum benefits.
So let's check back in with our patients. We have Greg, who's just finishing up his CoolSculpting procedure, and then we have Morgan, who's in the middle of hers. Greg, how's it feeling?
I'm very numb. I don't feel much, which is nice.
I love how we can actually see how the procedure has worked out. Give us your first reaction to seeing the machine come off of your skin.
It's kind of incredible. I don't really feel her even touching me right now.
Is this the first time you've done this?
Yes.
Okay, so it's an interesting experience for someone who's getting a first time. I kind of love that we're getting this first time testimonial of
Yeah.
Dr. Nowak. She's going to be, Diana is administering something called the
Z-Wave.
Z-Wave, which
Yeah.
is very loud. So for people that are hearing this right now, we'll explain what it's doing.
This machine here is a radial sound wave. This would be a cousin of what you would do to break up kidney stones. And so
wow.
we're using those little sound waves to actually help break up those little fat cells. We could see that it was a little bit raised and a little bit hard and a little bit numb. And so those little fat cells were causing a little extra trauma, a little extra injury to help get more to go away and get them to go away faster.
Several offices in San Diego and really around the country, they have a different technique after CoolSculpting. This makes this place unique.
Traditionally, CoolSculpting, you would just do a manual massage with your hands, and then it's dependent on the operator, how hard they can massage that area. And here we bring in the technology. It's very consistent, very comfortable, very easy.
We have these two patients as examples. You have someone like Morgan who's very fit. She's involved in health and fitness. How quickly will someone like her see results with CoolSculpting?
Yeah. Well, like I said, once again, we're going to see it quickly. What she's pinching there, she's going to be able to see that that's going to be less and less and less. And so most patients, 4 to 6 weeks, we can bring them in, take a look at their pictures, and we can show them that there's already different measurement-wise.
How often can you get CoolSculpting? Once a week? Once every day?
Yeah, so we don't need to do it every day. So we do the one treatment. For some areas, for some patients, that'll be enough. Some will come in anywhere from a month to 3 months out if they have a really stubborn area, and sometimes we're asymmetrical. Sometimes we'll have one side that bothers them more than the other. And so we'll go ahead and target that a second time.
When we talk about how often, a lot of people have the big question, which is how much does it cost?
Yeah. So the cost really depends on the number of areas that we're doing. Okay. So each one of those applicators, when we place it there, so it's totally customizable. It can be $750. It can go up from there based on the number of areas.
Let's talk to Morgan and check back in and see how she's doing. You look very relaxed.
I am. I am completely numb, so I'm not really feeling much. But again, I'm very excited to see results later on.
So I want to join in people who have been watching, maybe have some comments. There's a lot of frequently asked questions, Dr. Nowak, when it comes to CoolSculpting. And one of the biggest questions from people is, am I a candidate for this? Someone who has to lose up to maybe 50 plus pounds. Is CoolSculpting the right thing for them?
So CoolSculpting might be right for them. It's really at the consultation when we do the assessment. The ideal person is someone that's fit, active, exercising, has some areas that they're concerned with. They can't get them where they want to be. That's perfect. Now, it really comes down for us, though, is downtime or recovery time. If someone comes in and says, I can't have downtime with a procedure, and they have realistic expectations, then they're still a CoolSculpting candidate. Like I said, we can still help people that have a little bit more to pinch. It really comes down to their goal or their expectation. Now, we also, to compare this to a lipo procedure. That's someone that says, I'm looking for a more dramatic result. I'm looking for the results quickly, and I can have a little bit of downtime or recovery time. So another question that we get commonly is, do I need to lose weight with this procedure? So if they're going to lose weight, we'd rather they do it afterwards, because we're going to already target these fat cells, or with a lipo, I've already removed those fat cells. If they lose weight afterwards, they're only going to look better. Greg's done, so he can go out, have lunch, he can go exercise. There is really no limitation for him. Morgan, we have to finish up a little bit here, but then she'll be ready to go.
Okay. These two demonstrations were a great example of what CoolSculpting is all about. Thank you to our wonderful patients, Greg and Morgan, today for getting the full experience. And Dr. Nowak, thank you for having us here and showing us the full CoolSculpting experience. Right now, there's more than 6 million treatments being done worldwide and many more to come. If you want a free consultation, just visit our website and follow Nowak Aesthetics on Instagram and on Facebook, and leave your comments below so that we can answer all of your questions. Thanks for joining us.